The Mommy Makeover procedure is a combination of multiple procedures. It's not always the same for every patient. Sometimes it's after the first baby, sometimes it's after 5 babies, and the changes that they see in their body. So when they come in, we talk about those different changes they've seen. A lot of times it includes the breast and the abdomen. The most common procedures performed during the Mommy Makeover procedure are liposuctions, tummy tucks, breast augmentations, fat transfers to the butts, or even a breast lift or mastopexy procedure. The goal is to do it in one visit and get multiple procedures done at that one time, so they only have to go under anesthesia once. After childbirth, I usually have the patient wait at least 3 months before they start deciding on having the surgery. It also depends on the breastfeeding. So I usually make the patient have stopped breastfeeding for 3 months before we can perform a breast procedure. The patients will see immediate results right away. The next day they look in the mirror, they will see the change. However, giving themselves a little bit of time to heal and allowing things to tighten up, 3 months is about when they'll see the final results.